I'd now like to welcome to the floor Johnny Adams, CEO and Executive Director of Aging Intervention Foundation, who if will be unveiling protein-based aging accelerate practical translation of their interventions into practice. Johnny, as always, yours.
Well, thanks, Franco. Today, I'll be talking with you about how we will help the most innovative researchers and companies accelerate the creation of exceptional aging intervention therapies for the end result we all seek. And that is a great many more years of healthy living. My associates and I do that in a number of ways, like with many kinds of biomarkers and objective measures of aging, and information and software systems, and now telehealth. Today, we'll talk about a protein analysis system, a protein clock. Specific proteins have been reported in multiple studies to change their expression levels with age. The protein clock is an analysis system to measure them.
Johnny, apologies for interrupting.
Use is to compare baseline and follow-up results to measure the effects of age management therapies. The expectation is that older people who reset their protein clocks to a profile associated with younger people will be healthier and live longer. In some ways, it's like DNA methylation and other types of tests, but different in that it reflects the effects of more kinds of activities, including DNA methylation, and is closer to the end result, the phenotype. And there are other ways to apply this technology for personalized age management and to drill down into individual proteins to find deficiencies and excesses. And there are ways to evaluate and help with specific diseases. The protein clock can be useful in evaluating biological age, but in my experience, with any clock, what's most important is tracking improvements after a therapy. It's innovative and a much needed marker, and this could be a game changer. And I now have a working prototype. So the plan right now is to take it to the next level, to evaluate and verify low variability among samples, and refine and further improve the process, and verify that the process can be systematized to work in larger scale production. I've been working on this and its predecessor for several years. The costs of that good work was funded by the Aging Intervention Foundation, the Foster Foundation, and private donors. I have diligently worked without compensation. I want more healthy years and to make the world a better place. Your critical scientific review is most welcome. World-class scientists Benoit Lahallier, Tony Weiss-Correa, Maxime Chokarev, and Adiv Johnson developed the original protein clock, and they wrote a paper about it. The one I have is adapted from it. So let's take a look at that original paper. I'll now show my screen. Okay, data mining human plasma proteins generates highly predictive aging clocks. Okay, they did this test with 4,363 individuals. And if we scroll down, we'll take a look at just a small sample set, just 6 of the proteins with their values plotted against age. Scrolling down further, we see the learning set and the test set. Now, those of us who haven't met, and even if we have, it would be useful to take a moment at my background so you'll learn about what I've been doing well over 40 years to solve this problem of biological aging, and biomarkers and objective measures of aging have been an important part of that. So if you go to agingintervention.org and click return, it'll redirect to the website. This is the foundation, some writings, most of this I've done. But if you click on the background summary, it looks like this. It's updated regularly because I'm, like all of you, I'm constantly upgrading my skills and learning. Here is a new concept, aging metrics, and you should find this website interesting. It has a couple of tools that you could use. Also, a new initiative, Age Management Telehealth Physicians. As the name implies, clients or study subjects will meet remotely with qualified age management physicians. And I'm going to want to talk to many of you presenters about implementing your biomarkers. So Benoit Lahallier was the lead researcher on the paper, and he was kind enough to help me develop a practical clock based on his work. He's a real busy guy and very smart, and now director of data science at 𝐁𝐢𝐨𝐬𝐚𝐫𝐤𝐞𝐫𝐬. The process starts with drawing and processing some blood and freezing at -80, then sending it to SomaLogic to have their proprietary SomaScan protein panel run. The panel evaluates over 4,500 proteins, and that's soon to be upgraded to 7,000. Data is extracted from the resulting digital report, then a computational process is applied to the most important proteins associated with aging, as identified in the paper. Each protein is multiplied by a coefficient to arrive at a score, then these scores are totaled for each subject to arrive at a final score, and a lower final score represents a younger biological protein age. So for our next step, which will be a small scale project, 15 samples will be run. And we're now going to go just a little deep into the processing, but briskly. Okay, we'll just start with the end result. This is the ages and scores for 64 subjects, and if we plot it, we see roughly a linear relationship. And that's with some outliers, which is to be expected. And bear with me a moment as I reset. This is the original SomaScan output file. It actually comes as a text file, but it's much easier to manage if you convert it to a spreadsheet. The top is basically administrative detail. Then we see what looks like white space, and then we're getting into some subject data. And if we scroll to the right, up above, we will see protein information. Here is some of the proteins, CRBB2, beta-crystalline B2, CRAF, that's one of the members of the RAF family, and zinc finger and so forth. Now, if we go back down to the subject data, these are for each protein, these are the values for each subject. And if we scroll to the right and we keep scrolling and scrolling and scrolling, we will eventually reach 4,884 values for each subject. Okay, here are a couple of key files that Benoit sent me that are important in the final calculation. Here is the result of the very first subject I ran. This is a 55-year-old male, and we see these are the protein names. His score was a little over 17,000. Here are the scores for the entire test set that I ran, all 64. And again, we see it plotted against age. And we want to see how innovative therapies shift these numbers to a lower number toward youth. And, you know, my interest is practical application to evaluate the results of age management therapies. Okay, after successful completion of our next proof of concept verification, the new organization, Aging Metrics, will initially make it available as a research grade test to accelerate the work of the most innovative researchers and companies working on therapies that will get us a great many more healthy years. Maybe later on to FDA approval and broader use. Some of my specific interests are epigenetic reprogramming with Yamanaka factors and others, gene editing, senolytics, removing pro-aging factors from blood and tissues, and mitochondria therapies. Some of the innovative companies it will be offered to include Turn Bio, Life Biosciences, UVAN, Ocean, Altos Labs, BioViva, and Integrated Health Systems, Shift Biosciences, and Iduna Therapeutics. Some of the scientists include Rodolfo Goya, Juan Carlos Belmonte, Lord Lee Benner, MD, Harold Katcher, and 𝐁𝐢𝐨𝐬𝐚𝐫𝐤𝐞𝐫𝐬, Salvador Masip, Greg Fay, George Church, James Clement, and there are others, now and into the future. So much to do, so little time. We need more time. There have been some obstacles to overcome. One is the data and extraction process, which I solved. I've done a lot of that kind of thing with data in the past. The costs for the SomaScan range between about $650 to $700 per sample. I recognize that this is an international group, so hopefully you can convert that to your own currency, but it's, you know, it's kind of a lot. It would sure be nice if that could be brought down to something less. Although normally the minimum sample number is 40 for this test, SomaScan has generously reduced it to 15. Proteins where there was not an exact UniProt or sequence ID match between the output file and reference file, or where there was some disparity, were temporarily excluded before more thorough evaluation. For consistency, the phlebotomist would need to travel to each subject's location and draw the blood at about the same time of day and under the same conditions. And there are some post-draw processing and a high-speed centrifuge, portable centrifuge is needed, and cold shipping is required. Since we're in this for more healthy years, it will be offered to the most innovative researchers and companies at the lowest possible cost, and hopefully we'll find a way to offer it to them at no cost. And you know, donors and others who help in any way will receive some regular status reports and some other benefits, although if you contact me, I'll be happy to keep you informed. And I'll finally, in closing, I'll just show my screen one more time. Again, the thing I focused on today is the protein clock project. Lots more detail is available. I'm available to make presentations to scientists, donors, investors, you know, any others, lay people. And I need a protein scientist on the team, one with deep experience in this arena. And also, again, I and the team help the most innovative aging solutions creators with things like biomarkers and objective measures of aging, information and software systems, and telehealth. And I'm easy to find. My name's Johnny Adams. Here are a couple of email addresses. This one is probably the simplest, and GRG, I check it frequently. There's my cell phone number, and here are a couple of websites. That's all. Thank you.
You, Johnny. Exciting stuff as always.